Your digestive health could be telling you more than you realize. Today, we're breaking down the signs, causes, and tests for GI disorders and bleeding. Vital steps to catching issues early and staying healthy. Let's get into it. Our GI tract plays a central role in how our body processes food, absorbs nutrients, and keeps us going every day. But when something's not quite right, it can be more than just an occasional stomach ache. Let's break down what GI disorders and GI bleeding are, the conditions that can cause them, and why early detection through testing is so essential. Our GI tract includes organs in our digestive system, from the esophagus to the intestines. When we refer to a GI disorder, we mean any health condition affecting this system, while GI bleeding refers to blood loss occurring somewhere along this tract. Sometimes GI bleeding is visible, but it can also be hidden or occult, making testing a valuable tool for detection. So what are some of the common conditions that can lead to GI bleeding? Let's start with hemorrhoids. These are swollen veins in the lower rectum or anus, and they're actually pretty common. You might notice some blood during a bowel movement if you have hemorrhoids. Then there's diverticulitis. Imagine tiny pouches forming in the walls of your intestines, which we call diverticula. Sometimes these pouches get inflamed or infected. This is diverticulitis. It's known to cause abdominal pain and can also lead to bleeding in the GI tract. Next, we have polyps. These are small growths that can develop on the lining of the colon or rectum. Not all polyps cause symptoms, and they're typically benign, but certain types can become cancerous over time. Finding and removing polyps early can actually prevent them from turning into something more serious like colorectal cancer. Ulcers are another common cause. These are open sores that form on the lining of the stomach or small intestine. If an ulcer starts to bleed, it can cause noticeable blood loss, sometimes even leading to black or tarry appearance in the stool. Ulcers can be quite painful, often causing a burning sensation, especially between meals. Conditions like GERD and gastritis also affect the upper part of the GI tract. GERD is when stomach acid flows back into the esophagus, irritating its lining. Over time, this can lead to bleeding, especially if left untreated. Gastritis, on the other hand, is inflammation of the stomach lining, which can be caused by factors like infections, alcohol, or certain medications. This irritation can also lead to bleeding if it becomes severe. And lastly, we can't ignore colorectal cancer. It's a more serious condition, and GI bleeding is often one of its first signs. That's why catching it early with screenings is so important. Early detection can make a big difference in outcomes. So how do you know if something might be wrong with your GI tract? Symptoms of GI disorders vary widely, including abdominal pain, bloating, nausea, and changes in bowel habits. GI bleeding, on the other hand, can present as visible blood in stool or vomit, but it may also go unnoticed until a test detects hidden blood. In cases of chronic GI bleeding, fatigue is common due to iron deficiency anemia, a condition where the body lacks sufficient healthy red blood cells. Other common symptoms might include weakness, shortness of breath, or even dizziness. It's worth noting that not all GI disorders present noticeable symptoms, so routine testing can be helpful, especially for those at higher risk. There are several types of tests used to detect GI disorders and GI bleeding. Let's start with fecal occult blood tests, or FOBTs. This test takes a small stool sample to check for hidden blood, which could indicate bleeding in the lower GI tract. A positive result might point to various conditions like polyps, ulcers, or even cancer. Now, FOBTs come in two types: guaiac-based tests and fecal immunochemical tests, or FIT. Both are effective for detecting lower GI bleeding, but FIT is preferred since it doesn't require any dietary preparation. Plus, it's often recommended as an annual screening tool for people over 45 or those with increased risk factors. FOBTs are a great non-invasive option to check early signs of GI disorders. An over-the-counter fecal occult blood test like Colonox FIT can give results in as little as 10 minutes, offering a convenient way to stay proactive about your health. Next up are DNA-based stool tests. These tests are designed to detect both blood and any abnormal DNA markers that could be linked to colorectal cancer or certain types of polyps. They're non-invasive, making them an excellent option for early cancer detection, especially for those who prefer to avoid more invasive procedures. Then we have the colonoscopy, often considered the gold standard for spotting issues within the colon. Colonoscopies allow doctors to directly view the colon, and they can even remove polyps or take biopsies of any abnormal areas that they find. While it's a bit more involved than other tests, it's incredibly effective for both diagnosing and preventing issues, especially for individuals with higher risk factors or concerning symptoms. If any of your stool tests come out positive, they are followed up by a colonoscopy. A colonoscopy is also recommended every 5 years for colorectal cancer screenings for people above 45 years. For a more direct look inside, there's also an endoscopic procedure. These involve using a thin, flexible tube with a camera, allowing doctors to see your GI tract up close. If we're looking at the upper GI tract, it's called an endoscopy, while for the lower GI tract, we use a similar procedure called a sigmoidoscopy. Both methods give a real-time view, often leading to immediate diagnosis and even treatment in some cases. And finally, we have capsule endoscopy. This is where you swallow a small camera capsule, which captures thousands of images as it travels through your GI tract. It's especially helpful for detecting bleeding or other abnormalities in the small intestine, which can be hard to reach with standard endoscopy. So why go through these tests? The main benefit of early detection is that it allows for timely and effective treatments. Many GI disorders are more manageable when caught early, and detecting issues like polyps or early-stage cancers can prevent them from progressing. Early treatment often results in simpler, less invasive interventions, so proactive testing can truly make a difference in health outcomes. Regular testing is particularly important for those with a family history of GI disorders, as they may be more susceptible to developing related conditions. Tests like FOBT, FIT, and colonoscopy allow us to catch potential issues early, giving us the best chance to prevent serious complications. To summarize, the GI tract is vital to overall health, and problems within this system can range from mild to severe. With various testing options available like FOBT, FIT, DNA-based tests, and colonoscopy, we have powerful tools to help detect GI disorders and GI bleeding early. By taking these steps and paying attention to any symptoms, you're actively working to maintain your digestive health. Thank you for joining us today. We hope this information encourages you to consider routine testing and stay proactive about your GI health. For more details, or if you have questions, feel free to reach out or check out our resources online. Stay healthy, and we'll see you next time.